Thank you. Hello, everybody. My name is Ines. I'm the CEO of Shivom. I actually just arrived from San Francisco. It's my first time here in Latvia. Really great to be here, especially as Latvia and the Baltic celebrates 100 years of independence. So really pleased to be here. And today I'm going to, for the next 15, 20 minutes or so, we're going to be talking about the future of healthcare and precision medicine and wellness. And the two speakers that we had already today touched on such very important topics. And why is this particular presentation relevant for all of you? First, of course, there's investors and entrepreneurs here, innovators. And so we're going to be covering some areas that I think are going to be very relevant in terms of how we look at the future. But more important, and especially relevant for this particular conference, which is very special, Jamie earlier was talking about power and how that's going to be very relevant in the digital future. And what we're going to cover is actually empowerment. Through technology, we're going to do so much, especially what we're trying to do at Shivom. We believe we're going to have significant impact in terms of how all of you in this room are going to be key stakeholders in the future of healthcare. So with that in mind, let's go ahead and get started. So I'd like to first begin by talking about Henrietta Lacks. Some of you in this room may have heard of her name before. There's been a few documentaries and there's been movies. I would argue that Henrietta Lacks is one of the most important contributors to medicine, really, in the past 100 years. And in some way, the contributions from Henrietta Lacks will probably either directly or indirectly affect you and one of your perhaps family members or loved ones. Now, about 100 years ago, right around the time when Latvia and the Baltics actually were declaring their independence, Henrietta was born in the United States in a state called Virginia. She was born and raised on a plantation farm, and at an early age, she got married and basically had two kids. When she turned 21, her and her husband and family, they moved to a state called Maryland. And within the next 10 years, she had 3 more children. Now, after her 5th child, a few months, she started feeling some significant pain, abdominal pain, and she was also hemorrhaging. She went to the hospital, and it was determined at the time that she was suffering from cervical cancer. And unfortunately, it was malignant, and within a few months, she succumbed to the illness. Now, a few months before she passed away, doctors at the time were able to biopsy and take some healthy tissue as well as some cancerous tissue. And unlike all the other cervical patients in leading up to Henrietta Lacks, those particular cells effectively died within days. Now, Henrietta's in particular actually were able to multiply and thrive. And this was actually a very big deal because researchers and doctors all around the world now had cells in which they can do a lot of analysis and research. So very quickly, they cultured the cells and they distributed it globally. And since that time, these have been so-called, the HeLa cells, Henrietta Lacks cells, have been called sort of the immortal cell line. All of these cells have led to hundreds of thousands of publications. They've been used in so many different research studies that have led to many different vaccinations, which you can see on the screen. And all of the different diseases that you see, researchers today continue to utilize these cells in order to conduct significant drug discovery research. So this is amazing, right? But unfortunately, there is some tragedy and some real challenges that come from Henrietta Lacks' story. So at the time when she had her biopsies, doctors essentially took those without her consent. She actually had no idea that researchers and doctors are going to be able to take her cells and use it for research. Over the next 25 years, in fact, nobody in Henrietta Lacks' family were even aware that researchers and doctors were using her cells for all the different research around the world. And of course, there's been billions of dollars that have been made from Henrietta Lacks cells, and not a single penny has gone to Henrietta Lacks' estate and family. So everyone in this room, we think about this and we think this is very troubling. How is it possible that somebody who didn't have consent, has made such a major contribution to society and to healthcare, did not derive any immediate or future benefit? And so we think this in mind, and I want you to think about it as we move forward in the rest of the conversation. Now, this is just one piece. In fact, this was almost, in the past 100 years, the same problem continues to persist today in terms of how we have ownership over our very sensitive data. And so when we talk about the healthcare system, we all know, no matter where we travel around the world, the healthcare system, it's broken. So ownership, transparency of your data continues to be a major problem. Data sets are siloed all around the world. You would think that there would be avenues at this point where there would be robust collaboration, and there's still a significant amount of data sets that are siloed. And we all know routinely we keep hearing about hacks of databases. Unfortunately, a lot of the data is just simply not secure. And where we are today in healthcare, it's still very reactive, and medicine is not customized and personalized, and of course that can lead to some safety considerations. So we, all of us experiencing healthcare, realize that there's so many different improvements that still need to happen. On the pharmaceutical side, there still continues to be a lot of inefficiencies, a lot of friction. I already noted about the data, which continues to be very siloed. Patient stratification continues to be very challenging all around the world. Everything from dosage optimization to therapeutic combinational medicine, all of these things still need to be optimized, and so there's a lot of different areas that need to be improved in order for costs to come down for drugs around the world. And of course, a very big one is diversity in data sets. At this point in time, approximately 80% of the genomes around the world that have been sequenced actually come from the Western Hemisphere. And so what that means is a lot of the different drugs or possible drugs that are developed are actually only good for particular populations. And so if you're doing research in drug discovery, diversity of data sets is critically important. And at this day and age, when data continues to be siloed, it's obviously very, very inefficient. Now, no surprise, healthcare continues to be rising in demand globally, right? You have aging populations, as we've talked about. There's a lot of inefficiencies when it comes to healthcare. And we continue to look for therapeutic benefits across so many different areas. And so no surprise, when you look at across the planet, we are in demand of better healthcare. But we're actually in a very interesting time, and the first two speakers, of course, pointed to all the different avenues of technology that's happening in so many different areas. And because of that, we're actually realizing a lot of economic benefits, a lot of economies of scale. And when we're talking about genomics, which we'll be talking about in greater detail, we've seen the cost of sequencing genomes come down considerably. Almost a little less than 2 decades ago, it was billions of dollars to essentially sequence an entire genome. And we're predicting essentially within a few years that cost can come down below $100. So at some point in time, probably every single person in this room will have their genome sequenced. It's very important as we start to understand all the different avenues within our makeup that's going to dictate how we manage our wellness. And of course, this is a technology conference, and we're at an important point in time where so much technological convergence is happening. So we heard earlier about artificial intelligence. So we have tremendous processing power right now in terms of data analytics and being able to use powerful algorithms to understand patterns in data. And of course, we also have the emergence of the blockchain technology, which some of you probably have heard about quite a bit in the past year or 2 years. And this has been tremendously important in terms of transparency, in terms of verifying data and auditability. And transparency is going to be so important moving forward in every aspect of society, and especially when we're talking about healthcare and very sensitive personal data. And so with that, I'd like to introduce you to Shivom. So Shivom is a healthcare technology company that's focused on developing the world's largest and most advanced genomics data hub and healthcare services platform. Today, when you talk about genomics essentially is our own personal blueprint. And so it becomes very important when you start to understand what that means for your makeup, how to manage your wellness. And sort of the first generation right now, and maybe perhaps you or some of you and your family, your friends, has started to get DNA kits, right, to start to sequence, understand a little bit about your genealogy, ancestry. But as you start to dive deeper, you will learn so much more about yourself, and this is only just the beginning. And we will see a future, really in the near-term future, where we're going to do so much more with sequencing analysis that you're going to learn what medicines to take or not to take, what foods to eat or not to eat, what predispositions you have in terms of illness. All these things are insights that we're all going to start to learn as we start to bring technology together and the latest advancements in science. And what Shivom is doing is we're going to look at that next generation of sequencing. Right now, we're getting some preliminary insights, but we're going to move more towards additional avenues that, beyond just looking at known variants that may be indicative of illness, we'll look at your entire genome, your entire DNA. And this technology already exists, but costs are coming down. It's going to make it much more affordable for everyone in this room to be able to have that sequence done. And once that's done, you're going to have powerful analytics that give you all tremendous insights about yourself. And with Shivom, in addition to the processing and the analytics, we're also going to use powerful encryption and security to make sure that your data is very secure, it's anonymous, it's encrypted, and it's fully within your control. And because of the blockchain, it will be very transparent. Everything that happens in terms of the transactions of your data, how you're using that data can be verified on-chain and will be very visible. And again, it's a matter of your control in determining who has access to your sensitive information. And so Shivom, as I mentioned earlier, it's really an ecosystem. So we will have a marketplace essentially where you can determine, once you have your data sequenced, you can determine if you want to learn more about, get more insights, if you want to procure additional services, and also, of course, if you want to participate on the clinical side. So in this current stage right now, when there's clinical trials and R&D, there's a lot of intermediaries at play right now, and I think Jamie touched on it earlier, is that most of the prevailing models right now are essentially based on data brokerage business. And what we're going to be doing at Shivom is essentially giving that power back to the people. You own your genomes, that is your data. When the time comes for clinical trials and pharmaceutical companies or CROs need the data, that's something that you will have to be able to have that decision. And if you participate, then you can monetize. This is something fundamentally very different to what's happening right now in terms of the business models out in the marketplace. And through our ecosystem, the grounding key element of all of this is your genome. And from there, we have an ecosystem of products and services. There'll be third-party apps. And of course, there'll be the clinical element, and all of that is going to be powered by our Omics token. We have a cryptocurrency token that we use that is essentially the fuel for our entire marketplace and governs all of the transactions that happen on our platform. So for consumers, again, it's a function of control and ownership. You'll be able to determine, again, who has access to your data. This is something that actually is not happening at all right now, and I think we can all attest that when you want to understand who's had a chance, any third party that's had a chance to see your data, it's something that we really don't have any visibility to. And so as we move forward, companies like Shivom are going to be able to give you that level of control, that granularity of control, which is going to make very significant difference in who has access to your data and who's going to be able to use it for research purposes, and if you decide, you can determine if you want to monetize. And so what does that look like practically? So with Shivom right now, we're estimating that by January, we're going to be in a position where people who come to our platform will be able to order sequencing kits. Those kits, there are some already out in the marketplace now. You'll have a significant amount of choice in the type of kits on our platform. You'll order the kits, and you'll get sequenced. Once that data is securely uploaded on our platform, and it's also verified on-chain, you'll be able to get additional insights through different analytics, and you'll get tremendous insights, again, back to some of the things that I touched upon in terms of how you manage your wellness, if you have certain predispositions to illness. And at that point, you can determine, of course, how you want to share the data, if at all. Some people choose not to share, but if you do, you can determine who has access to it. And again, at the end, you can determine if you want to monetize on your data as well. And all of that transaction would happen between the clinical enterprise and yourself all secured by blockchain technology and through the use of our Omics token. And so at the end of the day, Shivom, again, it's all about control and ownership. You'll be able to determine who has access to your data, how that data is going to be used, and if you want to monetize it all, and to gain additional insights over your wellness. And so today, what I'd like to do, actually, in the past few weeks, we have been essentially in a testing environment. Our team has been working around the clock to build this platform, and being here at this very special event, we wanted to take the opportunity to actually demo our latest iteration of our platform, our alpha version, and it's actually going to be going public live right now during this conference. And so we'll give you a sense of what we've built, and then I'll tell you a little bit more what's to come. So right here, what Tim is doing, essentially we're navigating into the Omics platform here. And through the platform, initially, of course, you'll be able to create a profile, determine whether you're coming from the consumer side or on the enterprise. And what Tim is doing here is he's basically logging in as a consumer onto our platform. Great. So obviously, once you fill in your personal details, very important in terms of the Shivom platform itself, you start to determine your profile. We have questionnaires and surveys that are very important as you start to create a profile about yourself and areas of concern in terms of your medical situation. And again, all of this is secure and totally by choice. And when we go here on the consent, very important on this platform is consent and permissions, right? So we do this at a very granular level to make sure that you have full decision as to who will have access to your very important sensitive data. And as you can see here, Tim is scrolling down. Basically, there's a lot of different, and we'll be building on these particular consent permissions forms, but for now you can see that you can even determine at a granular level all the different types of organizations or people who may have access to your information. And of course, you can change this at a given time. Now, once you get your sequencing kit and you get your genome sequenced, you'll of course then have the choice to be able to securely store and upload that data onto the Shivom platform. And what Tim is doing now is essentially taking that file and securely storing it onto the Shivom database. And very important as part of this platform is that we're using our Omics tokens. So in this iteration right now, we have essentially an integrated wallet. And so what the wallet here can show you, of course, all your different balances, and as we move forward, basically you'll be able to see all the different transactions that have happened, and all of this will be recorded on-chain to be verified, fully visible and transparent. And what you can see here as part of this very early iteration of our marketplace is that first, of course, you'll be able to pre-order the different kits that will be available. Then later on, you'll have your full choice in terms of different reports and insights that you can get in terms of managing your wellness. And then you'll also have the choices very soon in terms of telemedicine. For example, if you're looking for a genomic counselor to help you better understand what your genomic sequencing is telling you. There will also be third-party apps, and as I mentioned, of course, there'll be a very significant clinical element as well. You'll be able to participate in clinical cohorts, or of course, in any type of drug discovery R&D that pharmaceutical companies or CROs are organizing. Okay. And so if you want to find out more information, you can certainly go to our platform. What we're doing in the next few weeks, we're going to actually have a few more releases as well. And it's going to be much more geared beyond just the consumer element, is also going to be on the enterprise side as well. So what does that mean? So as people start to populate on our platform, clinical organizations and enterprise are going to be able to come onto our platform, and they're going to be able to look for particular data sets, genotypic, phenotypic information that they're looking for their particular studies. And again, it's about ownership and control. If you want to participate in these kind of studies, then you can do that, and there will be essentially a handshake that happens on our platform. And if there's any monetization that occurs, it would come to you and not into any intermediary, which is the case right now. And this just gives you an overview. Essentially, enterprises would create accounts, and then once they're on the platform, we're going to have fairly robust filters and search criteria that'll label them to anonymously search on the different data sets. And through smart contracts, if there's an agreement that two parties will agree to share the data and run analysis over it, then of course there will be a transaction that occurs on the blockchain when it will be verified, and there will be an exchange of tokens. So just quickly on our timeline where we're at, we actually concluded our fundraising in May of this year. And since that time, the team, we've essentially been growing. We have a large office right now in London. And we've been growing the team, but very much focused on development. And we're on track right now with our alpha release. And come January, essentially, we're going to be in a position where we'll be our next release that's going to be much more robust on the enterprise side. And we'll be in a position to start offering kits as well and also reports. So we encourage everybody in here and who's tuning in, of course, if they want to participate with Shivom in sort of the future of precision medicine and healthcare, we encourage you to come on our platform. And we've got a lot of benefits, particularly for the early users and adopters. And that's it. So we again, thank you so much for the opportunity to be here. And you know, if you're interested in the Shivom journey and what we're doing to democratize genomics, advanced medical breakthroughs, please then come to the platform and connect with us. And we look forward to working with you on the future of healthcare. Thanks.
Thank you, Henry. Stay here.
Sure.
Maybe we have some questions to Henry. Okay, good. Try to catch this.
Okay. Can I link my DNS data from another platform, let's say MyHeritage?
Great question, and I love that question because, so you know, when we go to different places, a lot of people are like, oh, well, I've already had my DNA sequenced. We encourage you, for all of those people who have already had their genome sequenced, please come to our platform because now you actually have control, right? What's happening right now, and as I mentioned, it's a data aggregation model. Jamie, I believe, touched on it earlier as well. That's the existing business model. And so we really want to democratize that and give that back to remove as many intermediaries and filters as possible, so in layers. So if you've already had it done, you would upload it to our platform. And again, right away it would be discoverable subject to your decision for consent and visibility on the platform. And if there are researchers or clinicians that need your data, you would have a conversation on the platform, and then there will be a smart contract arranged for monetization. And again, that would be your choice for control as opposed to the other prevailing platforms right now, which the moment you do your sequence, whether you know it or not, you're signing off on that consent to allow them to share it with third parties. Yeah. Yes?
Hey, all right, I didn't even have to catch it. Great talk. I just went to a talk not long ago in London on the topic and more on the kind of ethics side of what's happening with this. So just a quick question on your thought on, I heard that the team behind Tinder was looking very much at the whole genetic mapping and looking at that as a possible use case for it, right? Is really matching people up at a genetic level, if that makes sense. Is there one thing about this from an ethics point of view that keeps you up at night?
You know, this is really uncharted territory. And, you know, it's an interesting story you mentioned. I think some of you may have also recently heard about the researcher that was just in China, which did some gene editing as well on embryos, right? So there are certainly a lot of ethical issues around this because obviously the more insights you get, there may come a point where people start to make decisions about, well, what genes that I want? Can I fix it? Can I edit it? And in that particular case, you know, there were twins. Who made the choices for these twins and how does it affect their future? If you remove certain genes, there's implications for that as well, right? And so there's a lot when it comes to this space, but for us, we look at it more from the perspective of control, right? Because in the early stages right now, nobody has control over their data right now. And in fact, even if you think you do, there's so much of it that's been shared, and certainly you're not, whether it be monetization or philanthropic, that's very little control that you have over it. And so we come at it from a perspective of using technology to empower people when it comes to healthcare and having that transparency. But there's no doubt there are going to be a lot of ethical issues raised on it, and we we're early in the game, but we want to make sure that through the use of our technologies that data is secure, and ultimately you have the decision to make in terms of how you want that data is going to be used. Yeah.
We can have one last question. Do we have any? Okay, can you pass the catch box?
How you doing?
Thank you. You're a great speaker.
Oh, thank you.
When I would submit my genome for a predisposition to genetic diseases, what if I don't want to know about fatal diseases?
Oh, another great question. So right now, when that happens, right, first off, you're going to get some information right now, and then you won't even really, it's a statistical question, right? So a lot of times, people may not even understand it, so obviously you should speak with a genomic counselor to help give you insights. Now, but that might not be good because philosophically, you may not even want to know, right? Because some people are like, why do I want to do this? If I find out, then some people are like, oh, I'm going to go jump on a boat and go sail off and have a wonderful life. And then some people, their lives would be completely ruined. So the wonderful thing is that what we do with technology, we have a lot of granularity of control. So through smart contracts, you could, for example, say, I want to get my genome sequenced, but I only want actionable information. I don't want things that I can have no control over. But maybe I'm predisposed to diabetes, so that means I can do some different things to manage my wellness. And this is a lot of what this is about. There are obviously conditions when you're talking about illness and you want to look for therapeutic benefit. But for a lot of people who are healthy, it's how do we manage our wellness better? And a lot of people are saying when we go down this path of precision medicine, bioscience, this is the next industrial revolution, it's all going to be around using this data for better healthcare. Well, then perhaps you live from the average age of 80, 90 to 150. Now, there's other social implications that come from that. But the point is that we will go from an era where it's reactive to being very proactive. You will be your own doctor, right? You will have different AI interfaces that you can engage with. But all that data is going to be at your fingertips, and you'll be able to decide, and be empowered, really. Empowered to know, hey, I really should do that. I can ignore it. But it'll be your choice on how you want to live, and hopefully you live it better.
Okay, thank you, Henry.
Okay.
It was
All right.
such an inspiring speech.
Yeah,
Thank
good,
you.
Good. Thank you.